Hey, it's me, Amelia Lady B, and welcome back to my channel. Today I'm getting your life together. Some of y'all didn't want to click on this video because you saw the title of it. Some of y'all click on this video because you need to know, what is it that I'm not doing that I need to start doing? I need to get my life right. I told you in 2022, I'm getting your life right. We're going to be talking the nitty gritty. We are going to be getting into some information that you all need to put into position for yourself. So let's get started. Okay, so when it comes to our health, there are groups of people, right? And so there are people who will go to the doctor for a sneeze. There are people who are going to look up symptoms because they hit their toenail on their bed. You have people who are scared of the doctor, those who will just not go because they don't trust the doctors. It's a whole conspiracy out here in these streets and they're not going nowhere. There are people who are just scared. They just are afraid to find out if they actually do have an issue in their bodies. I mean, the list really does go on, but these are just a few other groups of people that are out there. So why am I targeting my black sisters? Listen, because I know us. And I have a few friends that are who don't listen, and I hope they're watching, because I don't sugarcoat nothing when it comes to you need to go to the doctor, you need to pay attention to your body. I am all for it, and so here we go. So the first thing I need us to stop doing is putting things off. Stop putting things off. Stop putting your doctor's appointments off and pushing it back, because eventually it gets pushed back into the following year. Stop putting that off and stop ignoring your symptoms. 9 times out of 10, when you put things off, you're prolonging pain. Symptoms can get worse and things can get worse than they actually are. So I would really strongly encourage you to not put things off and not to ignore your symptoms. I had to learn this lesson the hard way when I put things off, as far as I actually went through a period of the doctors I went to were just stupid, and I just got frustrated, and I just stopped seeing a gynecologist for like 7 years. So in the instances that you are kind of in that position where you're tired of doctors telling you that you're crazy, then this next step is going to help you. The second thing that I want you to start doing is to research your doctors. So I know a lot of times, sometimes we ask a friend what doctor that they have and we'll go to their doctor, or we ask auntie, what's the name of your doctor, things like that. Or sometimes even when you get your insurance on your job and they have a list of doctors, you just tell them to choose whatever primary care, or you just choose whatever the first name that comes up on the list because you don't want to do any research. That's the wrong thing to do. Why? Because you want to know what type of doctor you're going to and who they are. I like to look them up to find out if they have any malpractice issues. Also, if they specialize in something specific. So for me specifically, if I'm looking for another gyno, I want to make sure that they specialize in endometriosis. I also want to look for, do they have any experience with menopause, or do they have in their office a doctor that specializes in menopause or hormones or something like that. So I want to find out that information. Same thing when you're looking for a primary care doctor. You want to find out, are they, because they have general practice, they have, internal medicine. What are some of the other, I can't remember, but you definitely want to find out what their specialties are. And within that office that they're in, do they have other doctors who specialize in something else as well? You want to look at what hospitals they're associated with. So I'm in South Florida, and in Broward County at that. So there's a difference between counties as well. So in Broward County, our main hospital is Memorial Hospital. So when I look for a doctor, I want to make sure my doctor is with Memorial, because sometimes they can be associated with other hospitals outside of the county or within the county, but that are private hospitals. I prefer Memorial because all of my doctors are associated with Memorial. Anytime I go to the doctor, their information or all of my information is uploaded to something called MyChart. I'm able to go to the app and get all of my test results. I'm able to see everything in MyChart, and I don't have to, when my doctor says, did you have blood work done or did you have something done, I'm like, yes, I did. And they'll go into MyChart and they're able to look for it, and I don't have to ask another doctor to send some information over. So it's very important to find a doctor that meets your needs, that specializes in what you need them to specialize in, and also that has a good reputation. You want to look at what their bedside manner, if anybody's coming, think about that. Of course, everybody has their own personal opinions, but for the most part, if you get a generalized consensus that the doctor is just amazing, then go for it. I would advise for you not to, if you say that you have to wait for the doctor, listen. My gyno, and also I have another doctor, even my primary, is it my primary? I don't think it's my primary. I can't remember. But anyway, a review, most of the reviews say you have to wait such a long time to see them and all this kind of stuff. I hate going here because it takes a long time to be seen. Here's the thing. I will wait for my doctor because I know he's good. I wait for my doctor because I know that he pays attention to me, and then when I go in, my appointment is my appointment. He answers all of my questions, and he makes sure he does a thorough exam. So I will wait for that. I'm not for waiting for a doctor who will just spread through, not look me directly in my eyes, ask me, okay, so let's get started, without asking me how I'm doing, how is it going, anything like that. So I will wait for my doctor. So definitely, it's something to look into. Research your doctor. Again, if you don't like the doctor when you go for your first couple of visits or something like that, then switch your doctor. But do your research. It's very important that you do that. All doctors are not created equal. Just because your auntie go to a doctor don't mean that doctor is right for you, and so forth and so on. And just because you've been seeing a doctor since you were 12 years old, or since they've been in the family for years or whatnot, since you were in your early 20s, it might not be the right doctor for you for the stage of life that you're in right now. I'm just saying, putting that out there, okay? The third thing, get second opinions, and also do your research on treatments and medications. Okay, so I say this because I know I didn't do that when I was told about my hysterectomy or anything like that. I like my doctor. I really trusted my doctor. Still do. I don't think he made a wrong decision, honestly. And I don't think that I made a wrong decision in trusting him as well. But I will say, for the most part, to get second opinions if you feel a little off about a diagnosis, if you're not really sure, and also if you're kind of feeling a little off about what treatment plans that they have for you. So let's say you get diagnosed with fibroids and your doctor immediately tells you, well, you need to have a hysterectomy. In that instance, I would definitely prefer you go for a second opinion to another doctor, someone who specializes in fibroids. Reason being is because a lot of times there are doctors who are quick to go to hysterectomy, especially for us, as Black women. One, we get diagnosed incorrectly, in a crazy amount for all different types of issues versus what we're actually going through. Okay, so there's so much behind that. I mean, as we know from history, even like even back to, with Henrietta Lacks and all this kind of stuff. And we think about ourselves now, we're now in 2021, but doctors, there are people who still see us as that. They still see us as science experiments. They still see us as individuals who can tolerate any amounts of pain. It's almost like we're not seen as human beings. As we know, over the recent years, over the years, we're just not seen as human beings. And so we have to really take things into control in our own hands. And I know that's why a lot of people feel a little don't like going to the doctor, and I do understand it. But until we stand up for ourselves, until we start advocating for ourselves and really taking charge of our doctor's appointments, we have to make these doctors listen to us. Serena Williams had to, insist that she has a blood clot and she can't breathe, and different things were happening in her body. And sure enough, she had a blood clot. The woman could have died in the hospital and never had the life that she has right now, with her daughter. And so it's very important for us to speak up. It's disgusting, yes, but it's very important for us to speak up. So I would strongly encourage you to seek a second opinion. I would strongly encourage you to research the doctors that you're going to. If there's a Black doctor who specializes in it, definitely go for it. But definitely find someone who specializes in what you need assistance or need help with, and see what types of treatment they recommend. When it comes to treatments, before you take any medication, you are allowed to tell your doctor, hey, give me a week and I'll get back to you if I want to start this medication. If you decide that this medication is not right for you, you talk with family, friends, or you pray about it, or do whatever research that you need to do, and you find that it's not the best fit for you, or you don't feel comfortable with it, then you don't have to take it. There is not a mandatory, there's nothing mandatory about taking something. But I definitely want you to do your research first, before you say yes, or before you even say no. Look for different alternatives, see what's out there, and go from there. The fourth thing that I need us to do is start talking to your family. Start talking to your mothers, your grandmothers, your aunts. Unfortunately, I know there are those out there who do not have families, who were in the foster care system, and they don't have that. You all do not have that access to biological relatives. And so it makes things a little bit more difficult for you. And I absolutely understand. I think the best thing for you to do, and I'm speaking directly to those individuals, the best thing for you to do is definitely find someone in your circle that you can talk to, just to talk to. And definitely do your research on whatever medical condition that you are dealing with at the moment. And you'll be able to go through your process as such. Now, for those of you who do have families, you have your mother who's living, you have living women in your life, aunts and whatnot. Definitely talk to them, please. It is very important for us to really learn family history. And I think we talk about, the legacies and what they left behind, and you want to talk about, where you come from and the strength that you come from. But it's very important to learn about your health as well as your mental health, because that plays a role in your life, in your daughter's life, in a cousin's life, a niece's life. It plays a huge role. There are certain things that skip generations, and just because maybe your mom didn't experience, but you experienced it, and you've experienced it because your auntie experienced it, who experienced it because her great auntie experienced it, and the cycle continues. And so and I'm going to say things like fibroids, cysts, endometriosis, PCOS, are hereditary. They are hereditary things that are passed on through the line, and sometimes and heavily fibroids definitely in Black women. And so it's very important to talk to your elders in the family to find out what they dealt with. Did they have any diagnosis that you need to find out? Breast cancer, ovarian cancer, uterine fibroids, uterine cancer, whatever the case may be. It's very important to find out that information. That way you can put it on your family history list, and that way the doctors will know as well. For me, I didn't know that I actually had family members that had endometriosis, and so for the longest I had been writing on my documents that I had no one in my family that had it. And it's really weird because one of my doctors said, "Really?" And I said, "Yeah, nobody. Haven't heard anything." And so he was like, "Okay, that's different." He said, "But it does happen. It does happen." And so when I found out years later after my hysterectomy, and I'm like, "What the fudge? You mean y'all ain't said nothing?" And to be honest with you, I didn't even think to ask. I mean, I know I asked my mom's sister, I asked her, had she had any issues with her menstrual. She had severe pain, but hers went away when she had kids. So she was never diagnosed with anything. She had no fibroids, no issues with cysts, issues with like uterine cysts or anything like that, or with endometriosis, none of that. And so I was just like, okay. But come to find out, their half-sister, my mom and my aunt's half-sister, had endometriosis and had a hysterectomy. And then on that same side of the family, my grandfather's side of the family, another cousin had endometriosis, and I have found out another cousin has endometriosis. I was like, bruh, it's crazy. And even on my dad's side, I have a cousin that had endometriosis years back when I was younger. I didn't know, but yeah, she had endometriosis. And so, see, these are the things we need to know ahead of time so that we can. Does it stop anything? Maybe not so, but we know this information to provide this information, because maybe my doctors would have done an aggressive treatment for endometriosis. Not that I know that there's an aggressive treatment, but maybe there could have been more of them looking into it. It required more surgeries, but at least they would have been looking more. My appointments probably would have been more back to back versus once a year. Who knows? I'm just saying. But it definitely would have been different. And so to avoid the hassles of things, I think it's very important to know. And it's just important to know. It's just important to know. The fifth thing. Okay. The fifth thing. I need you to go to professional therapy. I need us to stop with the stigma of therapy. It is not for crazy people. It is not for people. It is not just for people who've had severe trauma in their lives as children, as young adults, or whatever the case may be. It is not. Therapy is for everybody. And I definitely, outside of God giving me the strength to do this, I definitely wouldn't have been able to do this without going to therapy. Before I started Millennial and Menopause, I was going to therapy for about a year prior to starting with Millennial and Menopause. And I realized I needed to go because I started to kind of like spiral. I started not to recognize myself. I was having like just outbursts of emotional just crying, and then I would get angry so quickly and annoyed very quickly. And all of that, and it was happening at work, at home, it was just happening in my life. And I realized that I wasn't myself. This wasn't Amelia. And because that was happening, I said, one, I ain't trying to lose my job, and I don't want people to think that I'm some, I'm a mean person, or I'm just out of control, because I'm not. I didn't have control. I lost control. I was not in control of me. I was not in control of myself, my emotions, anything. And so I knew I needed to seek therapy. And I know for us, it's like, that's the thing white people do. Or, white kids have to go to therapy because their parents jacked them up. We all get jacked up in some kind of way. We all get jacked up some kind of way in our lives. But definitely, why I say it really helps, therapy helps for anyone. But definitely when you're going through a health issue, I think it should be like mandatory. I really believe that physicians should just automatically tell their patients, I need you to seek therapy as part of treatment. Because it helps you to process what you're going through. Me personally, going to a therapist helped me to realize that, I'm not crazy, and it's okay to feel the way that I felt. It's okay to feel what I felt. It was okay for me to be angry. It was okay for me to be to not feel like I wanted to be a part of something. It was okay for me to say no. It was okay for me to set boundaries, period. It was just okay for me to set boundaries. And this is what you learn in therapy. You learn how to set boundaries. You learn healthy ways to cope. You learn how to live again. And you live on purpose for you. Like, you're living for you. You know what I mean? You're not living for somebody else. Or, I hope I'm making sense. When you're dealing with a health issue, there is so much going on in your mind. You're thinking, am I gonna die? What type of surgery am I gonna have? Am I gonna wake up from my surgery? For me, it was like, I can't have kids. What does this look like? What does my life look like moving forward? For anyone who has, any type of issue, like, seriously, like, we have to really stop thinking therapy is for issues, or therapy is only for crazy people, or therapy is only for, therapy is for everybody. We all need it at some point in our lives. If you're dealing with issues on your job, talk to a therapist. If you're feeling confused about, what your next step in life is going to be, you can seek a therapist. It's not like you have to sit there for 8 sessions. You don't necessarily have to. You don't necessarily have to be there for a year, a month, or whatnot. But I promise you, if you start going, okay? I promise you, if you start going, you will not want to stop. You will not want to stop. And if you do stop, that means you're at a place where you're like, yo, I'm good. Like, I can manage the daily life in a healthy way. I'm coping well. I'm doing well. And maybe all I need is checkups now, but I promise you, if you go, you will love it. I promise you, you will see things differently. And you will enjoy it. And for those of you who are Christian and who may not really necessarily, you may not believe in therapy, you'd be like, I'll just pray about it, go to God or whatever, go to God in prayer. That is awesome. Go to God in prayer, because trust and believe, I go to God in prayer, okay, all the time. My therapist is Christian, so I saw a Christian therapist. There are Christian therapists and they counsel as such. And that's fine. That is fine. Listen, we are everywhere, okay? So if your concern is, I don't know, because my therapist may not know God, they may not know the Lord. Listen, do your research. They're out there. They are out there. And they're ready, willing, with open arms to help you with whatever issue that you're going through. They will pray you through a situation. They will pray you through. And so with that as well, you're finding the right one for you. You find a therapist that fits for you. Okay, so those are your 5 things that I need us Black women to start doing. So stop ignoring your symptoms and putting things off. Do your research on your doctor. Get second opinions on treatments, on medications, on your diagnoses. Do your research and do second opinions. Talk to family, talk to friends, and also seek professional help. It's very important. I hope this video has helped you to see clearly and to help you to actually put things into perspective. For those of you who are unsure about a therapist, how to find a therapist, what to look for in a therapist, please head over to my website, millennialandmenopause.com, and there is a free downloadable worksheet for you. Also, if you're not sure of what to find or look for in a doctor, there is also something for you on my website, millennialandmenopause.com. Until next time, ladies, be blessed, bold, and beautiful. Bye.